et bienvenue à tous et à toutes. Hi all and welcome. Our webinar tonight is called What Do Canadians Think About Healthcare? And I'm Anne Lagacé Dowson, the comms person at the Canadian Health Coalition. I'm speaking to you from the unceded territory of Tiohtià:ke or Montreal, which is the territory of the Mohawks or the Haudenosaunee, the Kanien'kehá:ka people. Just to remind people who are, tell you what the Canadian Health Coalition is, it's a group of individuals, like many of you, researchers, 18 civil society and nonprofit groups, as well as health workers unions and labor allies. It was founded in 1979. And you can see on the masthead of our webpage a quote from Tommy Douglas, who said, "Unless there's a concerted effort to apply pressure on the federal and provincial governments, the erosion of Medicare will continue. Our best hope lies in the Canadian Health Coalition for the preservation and extension of Medicare." And there's a beautiful picture of TC Douglas at the head of our webpage. So earlier this year, the Canadian Health Coalition commissioned a poll, quite a large and significant one, from June into July on the attitudes of Canadians toward this beloved healthcare program, one of the most beloved, I think you can say, of Canadian social programs. And Steve Staples, who's our policy director here at the Canadian Health Coalition, was the anchor of the project with an assist from Anil Naidu of NUPGI, who's on our board, the National Union of Provincial Government Employees. The pollster was, of course, Derek Leebosh, who's the VP of Environics. They both join us now, and we're going to invite those of you who have questions to put them into the Q&A. Use that feature and we'll try to get to your query. On va traduire en français pour les amis francophones qui veulent poser des questions, mais la soirée se déroulera essentiellement en anglais. So Steve, let's start with you. Can you set the stage? Why a poll?
Well, Anne, thanks so much. Thanks, Derek, for coming on and having me here. We're in a precarious moment right now in terms of healthcare. I mean, it's always a top of mind issue for Canadians, but you know, according to the numbers, we've got 6.5 million people out there without a family doctor. I may be one of them. Frankly, I'm not even really sure if I have a family doctor or not. That is the strange. I go to a clinic and I think she's my family doctor, but I'm not sure 100%. But in any event, I think my experience is not unlike many other Canadians. So incredible volatility in our healthcare system, and also politically, incredible volatility going on right now with major political changes, by-election results this week, possibility of an election. We've got 3 provincial elections going on next month. Healthcare is always top of mind of all of them. So as an organization like ours, the Canadian Health Coalition has this kind of double mandate, and it's like we're riding 2 skateboards at the same time. One, we want to defend Medicare, and the other, we want to expand it. So it's a very difficult ride to carry. It's a ride, that's for sure. So we really wanted to ask Derek and Environics to give us a sense of the scope of the problem out there. We need to know what's happening out across the country. Help us find solutions. What do people see as possible avenues to solve some of these very wicked problems that we might have in our healthcare system? And thirdly, because we work on federal policy, but you can't really talk about healthcare, obviously, without provincial governments being involved. So Derek really dug deep. I mean, we asked him to go deep and find views province by province so that we federally can work with provincial counterparts to help confront the healthcare crisis. I'm very excited. I think the results that Derek got us, confirmed what we already knew, gave us additional insight into where the problems lie, and possibly a path forward in terms of getting our public healthcare system back on track.
Okay. And I should just mention, so if you think of this webinar as a hockey game, Steve was the one who was telling me to use this metaphor. Steve does the color commentary, and Derek is going to do the play-by-play. Now, I am not a hockey fan, but I think everybody probably gets that. Even those of us who don't like hockey kind of know hockey metaphors. So Derek, can you join us and describe the sample, how the poll was done, and just give us some more information? And you're going to throw up some slides so people can see the poll. And I was just going to mention also, for those of you who want to pursue it further, it's on our webpage. We've actually posted the poll for people to take a look at, and maybe we'll put the link up throughout the webinar just to remind people, because we want this to be a tool that people use in their advocacy work. Okay, so Derek, throw up a.
Yes, I'm just, can you see my screen right now?
Yeah.
Yeah. Okay, so just to start off with some methodological details, we did an online survey of 2,135 Canadians that we conducted between June 26th and July 9th of this year. So we wanted to get in under the wire before the Council of the Federation meeting. And you'll note on this slide that I've brought up, we did a somewhat disproportionate sample because we wanted to have larger sample sizes in some of the smaller provinces. So we we bumped up the sample size, for example, in New Brunswick and Nova Scotia to over 150, even though they're a relatively small share of the overall population. So I just wanted people to see that although it's obviously we have 10 provinces and 3 territories, and having a really large sample size in every single jurisdiction would be prohibitively expensive, but we did try to bump up the sample sizes somewhat as we went along. So that's basically a bit about our methodology. And do you want to move on to discussing some of the findings as we, or?
Yeah, let's just maybe just dive into the first sort of subject, which
Sure.
the sort of big headline, which is the numbers of people who feel that
Yeah, well, one of the first questions that we asked, and by the way, I mean the entire report deck is about 45 pages, and we're just looking at a few highlights during this webinar. So so this is not what I'll be going through is not comprehensive to everything that we asked about. But one of the key questions we did ask was whether people think that healthcare in their province is currently in a state of crisis. And we found that 3/4 of Canadians think that it's in a state of crisis. And that tends to be, first of all, it's very high all across the country. It's particularly high among women, among people with lower incomes, lower levels of education. You'll notice on the next page when we looked at this province by province, again, you can see that in every jurisdiction, the vast majority of people think that healthcare is in a crisis. Manitoba is actually a little bit lower, but it's still 60%. But you'll notice in the Atlantic provinces and in Quebec, it's over 80%. And if we move on to the next page, well, do we want to move on to talking about pharmacare at this stage?
I wonder, Steve, did you want to comment on the crisis figures though? Because
Yeah.
that was sort of like the headline figure. And we went with that as a sort of a news story.
Well, that's right. That is the number that when Derek mentioned that we posted this poll just before the premiers were meeting in Halifax, and the Canadian Health Coalition, along with the Nova Scotia Health Coalition, and many other organizations came together to put pressure on the premiers to deal with the healthcare crisis. The number that the media really picked up on was this 73% of people feeling like it's a crisis. And while that is good in terms of underscoring the feeling of people that are out there, it's always a challenge for us as campaigners because we know that some people will want more investment into the public system to improve it, while some others may want to greater access to private systems. So, in times of conflict, half people, want peace, the other want to prepare for war. So it's that kind of fight or flight reflection that you get to that kind of sensation of the crisis mode. And that's where it's really important for groups like ours and other advocates to be prepared to put forward solutions, to put positive things forward to solve the problem that help move people away from, fighting for their spot in the life raft or whatever, just to totally mix metaphors, to feeling that no, this is a collective problem, and our best solution is to work together, and that is, of course, what we want to put forward. So as we move into some of these other areas, we have to be able to put that positive vision, that public solution, out in front of people, acknowledging that there is a crisis at hand, that people feel it's a crisis.
I'm just going to jump in and say that there's been a request from Sangeeta Chopra Sharon, who's one of our attendees, who's asking if we can break down by education and income levels some of the responses, because that's of interest. One of our attendees is also asking about why we say family doctor and not primary care provider. Interesting nuanced vocabulary question. And then somebody who is very much in keeping with what I said off the top, which is how do we actually mobilize people to protect healthcare? So those are some of the questions that have already come in through the Q&A. And I'm going to hand it back to you, Derek, to continue showing us.
Okay. Yeah, and of course, what's interesting is to the extent that people think there's a crisis in healthcare, it's both a threat and an opportunity from the point of view of healthcare advocates, because there will be people who will see a crisis in healthcare as an opportunity to push a privatization agenda. And then on the other side, there are people who see it as an opportunity to push for possible remedies, including pharmacare, which we are getting into next. So, as I mentioned, we asked a question about explaining that Canada's public healthcare system doesn't currently include coverage of prescription drugs outside of hospitals, and we gave people an explanation of how a national pharmacare program could work. And we asked Canadians whether they would strongly or somewhat support, or strongly or somewhat oppose the implementation of a national pharmacare program. And I think what's very notable here is 75% of Canadians expressed support for it, with 40% strongly supporting it, and the proportion of people who oppose it is only 14%, and then another 11% are not sure, which is a very high number. And I think it's notable that even when we cross-tabulated this by how people would vote in a federal election, we found that 63% of Conservative voters support the idea of a national pharmacare program. Now, we should, of course, bear in mind that we're not giving people all the details of exactly how a pharmacare plan would work and how it would work in conjunction with whatever coverage people currently have. But I think it definitely shows incredibly strong support, at least for the principle of it. And when we look at the provincial breakdown, it's remarkably consistent all across the country. Like, it's consistently between 75 and 80% in every province. You see that strong support is a little bit lower in Quebec, but that's probably more because of some of the federal provincial jurisdictional hot buttons than attitudes towards it in principle. The highest level of support anywhere is in Nova Scotia, where 52% express strong support. So I think that that's quite notable. And we also found, when we mentioned that the first step of the federal government's pharmacare program was to work with provinces to provide free coverage for two types of medications, contraceptives, as well as diabetes medications and devices. And we found that 80% of people strongly or somewhat support that. And again, support is quite overwhelming across all demographic and regional segments, and again in almost every province. And I believe, although I don't have that slide in this deck, we also found that a pretty solid, I think 30 to 40% of respondents say that they or someone in their family would personally directly benefit from this. So I think that it definitely shows that there's a lot of support for at least the baby steps towards pharmacare that have been announced so far.
Just sorry if I could jump in, Derek. So
Sure.
pharmacare has been very much on our minds at the Health Coalition, because the CASA, the agreement between the NDP and the Liberals, collapsed or broke down or was ripped up, whatever description you want to use. And one of the conditions, or one of the criteria of that agreement, was pharmacare, which has passed through the House of Commons and is now before the Senate. And I wonder if you can give us some color commentary on the numbers on pharmacare and what's happening politically with pharmacare, Steve.
Oh, absolutely. So, there's that saying that success has many parents, but failure is an orphan. And it's really interesting to see the leaders of two federal parties claiming victory about the Pharmacare Act, when it was passed in June, both the Liberals and the NDP seemed to be prepared to include this in take credit for it and include it in their list of accomplishments. So I think that's a very positive thing, and is reflected in these polling numbers to give us some of these numbers in terms of where people were with getting their province on side. Well, the first province has stepped up. It's British Columbia. And there was an MOU, a memorandum of understanding. That is, we agree to find an agreement, essentially what that says. We don't have an agreement, but we agreed that we're going to be able to get an agreement on the two classes of drugs, prescription contraception and diabetes medication. But guess what? There was a big surprise in that announcement as well, too. Between the two, they added a third class of drugs, which is hormone replacement therapy. Oh. And that was incredible, a big surprise for us, because we always kind of knew that, well, British Columbia already has public coverage for contraception. They've had it for a little while. So what happens when, to their share of the pot when the federal government goes to them? Well, they probably could have just pocketed some of the money, as the health minister said, that the BC health minister said, but instead they said, we're going to make it further, expand the program to include hormone replacement therapy for all those women that are going through menopause. And he made this great story. He said, it's not a joke. We all joke about hot flashes, but it's not. These are people that are caregivers. These are people that are working. These are people that we all rely on. And it's not a joke, and we should be providing hormone replacement therapy for them. So what struck me is the brilliance of doing that, and also how easy it was. So part of our campaign has been to get the bill passed, get provincial agreements signed on, and then expand the list beyond these two. And I have to say, when you look at British Columbia, it almost looks like we're on the third stage already. As soon as they get an agreement, should the clock not run out on a federal election or their provincial election, which is coming up, we could talk about that. The timing is razor sharp to get this done. But if they can pull this off, if we can get it through the Senate, money flowing, get this agreement entrenched, get some free drugs going, prescription medication going to people, that's going to be a big winner, and it's going to be very hard to undo by any subsequent governments. So that's the play right now.
Okay, so let's go back to Derek, who's got the actual data and the slides. Did you want to add anything to the pharmacare information that was gleaned from the survey, Derek, or do you want to move on to the next?
Well, I mean, there's more on pharmacare, but I think that that Steve sort of summed it up quite well. I mean, I think that it's definitely a case where, if you can get the drugs actually flowing, so to speak, then I think that there's a good possibility that no matter what happens in the next federal election, a future government will realize that you can't put toothpaste back into a toothpaste tube.
Which is a phrase that Stephen Harper loved to use.
Yeah, well, it's a good phrase. Have you ever tried to put toothpaste in a toothpaste tube?
You cut the top.
My sink is quite messy. I would like to know how to do that, but I would add a little bit when we dig into some of the data, the really granular, nerdy stuff that Derek gives us in these tables. There was a bunch of stories that came out, but one was the relationship between what was classified as BIPOC people versus white. I mean, Derek, maybe you want to talk about how you distinguish between white and BIPOC.
Oh, well, I mean, we had a question in the survey on how people self-identify, in terms of ethnicity or race or whatever, and people, and so we grouped people who essentially were Black or South Asian or West Asian, or East Asian or Southeast Asian, etc. So we were able to look at the comparisons between. Actually, hang on, let me just take a look at our tables over here to see how exactly we split those. Yeah, so for example, in the survey, we had 1,478 respondents who classified themselves as white/Caucasian, and 657 who were Black, Indigenous, or a person of color, which of course include. I've never been crazy about the term BIPOC because it's sort of creating a category out of everybody who is not white, as if they necessarily have anything in common with each other. But in any case, yes. So we have a very robust sample size there. I didn't generally find huge differences between the BIPOC segment and the white segment overall in the survey. Like support tended to be very strong across the board. If anything, support for things like for pharmacare was, to the extent there was any difference, it was sometimes actually support was sometimes slightly higher among white respondents than those who were Black, Indigenous, or people of color, but not to any great extent. Like we're talking 81% compared to 76% support.
And what
Yeah,
about levels of education and income? Do we have
well, if
do we have
I
this
just want,
recognized?
just before we leave that topic, I mean, there was a couple of variations that I did point out that kind of confirmed what we sort of have heard in the past, is that the impact of a pharmacare program on affordability for people is really key, and also the number of people that don't have any coverage at all is roughly 1 in 5, about around 20%.
Yeah,
Now our
about that.
poll definitely
And they
confirmed
tend to
that
skew
also.
younger. They tend to skew younger as well for obvious reasons. And yeah, there's definitely an answer to Anne's question. You know, when you look at support for pharmacare, it's I mean, it's very strong across the board, but you'll notice that among people with household incomes of over 150,000, it'll be more like 67% instead of 80%. So it's still very high, but obviously people with higher incomes and people who are full-time employed are more likely to already have uh, drug plans of some sort. So there's less of a need there.
Uh,
And needless to say, support is always going to be higher among people um, who currently don't get their drugs paid for through their either through government if they're pensioners or through their employer.
So one of the
Definitely, and when you look,
sorry, if I could just jump in and ask a question. So one of the ways in which some of the provincial governments have said, well, we don't need a federal pharmacare program. We already have one. And that's been the discourse of Quebec. The CAC government has said, well, no, we just want the money. We don't need your policy. We don't need your program. And yet the vast majority of Quebecers and civil society and labor is in favor of the federal pharmacare program. So I'd be curious to see. I don't know if we can see the Quebec numbers on this, but that's kind of a surprising
Well, yeah, I mean, I
result.
think that might be, as you can see over here, support for pharmacare is ever so slightly lower in Quebec than in other provinces. It adds up to 70% as opposed to it being over 80% in other places. But again, that may reflect the fact that a lot of people in Quebec may feel that they, may be confused because they may feel that they already have something, or, this is sometimes pitched as an issue of jurisdiction, and then there's issues around Quebec nationalism and which level of government should control healthcare policy, et cetera. So, um, yeah. So to the extent that support is a little bit softer in Quebec, it may be less about people not embracing the idea of pharmacare as much as the old jurisdictional battles between Quebec and Ottawa that have a different dimension.
Similar numbers in Alberta, I see, where Danielle Smith has taken a similar position to Francois Legault. Steve, sorry, you wanted to say something?
no, that's okay. We can maybe talk about it a bit later if you
Okay.
want.
So is that are we okay with the coverage of the pharmacare issue?
Yeah, I mean, I think, well, we also asked people to what extent they would support their premier working with the
Ah,
federal government on pharmacare implementation. And needless to say, I mean, it's the same 80% that support pharmacare in the first place. And again, you can see that there's across the board support everywhere. But again, particularly high in the Atlantic provinces in Quebec, the percentage that strongly support is a little bit lower at 40%. But everywhere else, it's pretty consistently high. And you'll notice that Alberta is often, and Saskatchewan, or well, ironically, Saskatchewan is sometimes considered to be one of the more right-leaning provinces in Canada because of the provincial government that it has. But when you actually ask on the issues, it's remarkable how consistent the numbers are all across the 10 provinces, regardless of the political stripe of the provincial governments that these provinces elect. And what I thought was a particularly interesting question here was, given that we have 3 provincial elections coming up, we asked people, if your premier rejects working with the federal government on implementing pharmacare in your province, would it make you more or less likely to vote for them in the next provincial election, or would it make no difference? And 46% of people say they would be less likely to vote for their premier and his or her party if they reject pharmacare, and only 9% say it would make them more likely. I'm not sure who those people are. And the remainder are people who say it would make no difference or they're not sure. And when we look at that one by province, I think it's worth looking at, particularly in view of the fact that we have provincial elections coming up. In New Brunswick, for example, which is going to be having a provincial election this fall, 52% of people say they'd be less likely to vote for their premier if they rejected pharmacare. In Saskatchewan, it's 43%, which also has an election coming up. In BC, it's 46%. Highest of all is Nova Scotia at 54%, and I think Nova Scotia is probably looking at an election coming sometime in 2025.
Yeah, Nova Scotia and Newfoundland both have elections next year. Yeah.
Yeah.
Interesting.
So I think that this is a particularly juicy finding from that political perspective.
Steve?
This underscores the need for us as advocates for public health care to have strong voices in provinces for this. This is a program, unlike dental care, for instance, which was a completely federal program, did not require the cooperation of the provinces. Pharmacare does. And as we saw by the agreement, the MOU with the BC government announced last week. So this, I think, is really powerful storytelling material for people in provinces to get their provincial leaders on side and to use this as an election issue. Questionnaires to candidates and whatnot in those provinces where we have, like a lot of Canadians are going to be casting votes this fall in provincial elections, and I think this is something to absolutely put to people on the doorstep and to use in the
to make it an issue.
You got it.
Yeah, yeah.
And as well, any provincial leader could pick this up and run with it. Right. I mean, if you look at what happened in Manitoba, what Canoe's NDP won, it was a healthcare election. Mm-hmm. And even in Nova Scotia, arguably, their last provincial election was also about healthcare, and the Conservatives won. So it seems that no matter which party is prepared to champion healthcare, it's a vote getter for them.
So I wonder to what extent, I mean, given that there are at least 3 provincial elections this fall, have you had any contact with the opposition parties, let's say in Saskatchewan and New Brunswick, given that those provincial governments are not particularly enthusiastic? I mean, BC is obviously a completely different situation.
I think that some of our provincial colleagues are in touch and have been having meetings with them. It's still early days yet, and we're trying to, but this is a key time to begin to influence platforms because they're all, if they're not written already, maybe they're still drafting them now. So this is a crucial time for it.
I omitted to mention off the top that the Canadian Health Coalition collaborates with the provincial and territorial health coalitions right across the country, because so much of healthcare is administered provincially. And right now there are roughly 7 conservative provincial and territorial governments in place. They may not be called conservatives, but they are conservative politically, which is often a problem in terms of collaboration between the federal government and the provincial governments, whereas the populations don't necessarily line up with the government in place provincially, as Derek was just pointing out. So there are a lot of moving parts here, and some of that is about to change with those 3 provincial elections coming up before the end of this year. So did we want to add any further on that, or do we want to move to healthcare staffing and the shortage of primary care providers? As Steve mentioned, 6.5 million Canadians, it's estimated, don't have primary care providers, which would include nurse practitioners in addition to GPs, or omnipraticiens as we call them in Quebec. I don't know, where would you like to go next, Derek?
I guess we can move on to the healthcare workforce and staffing issues.
This survey is a gold mine of stuff. It's hard to
Yes. I mean, as I said, there are lots of
prioritize.
questions that we're not getting into here that are interesting as well. Um, but we did ask people because we found earlier in the survey there were questions about whether people had experienced different problems in the healthcare service and having not being able to access a primary care doctor was one of the things that was at the top of the list in terms of being seen as something contributing to the crisis in healthcare. And so we asked a question here saying, as you may know, there are serious shortages of healthcare workers across Canada, which has caused a crisis. And we asked people to assess the performance of their provincial government and premier in addressing this. And as you can see, about two-thirds of people think their provincial premier and government is not doing nearly enough to address this, and only 25% think they're doing as much as they can under the circumstances. Interestingly, when you cross-tabulate that by party support, NDP supporters tend to be most overwhelmingly think that the provinces are not doing nearly enough to address this, largely because they don't have all that many provincial, they don't have that many governments to blame either federally or provincially. Um, and when you look at this province by province, you can see that again, it's all very consistent that people think the provinces that are not doing nearly enough. Uh, it's almost always well over 60% in every province. And when we got into um, ways of solutions for this, we pointed out to people that healthcare is primarily a provincial responsibility, but that there has been talk about implementing a national strategy to deal with staffing issues. And we asked people to what extent they would support or oppose their provincial government working with the federal government to develop a comprehensive strategy to recruit and retain healthcare workers, which I suppose some could say is a bit of a motherhood issue. But what we consider to be a motherhood issue is sometimes not seen as being so simple by provincial governments who guard their jurisdiction very jealously. But we found pretty overwhelming 81% support for the idea of having that level of cooperation. And on a similar note, when we asked people about whether Canada's premiers should implement an immediate emergency increase in healthcare spending that's targeted at recruiting and retaining public healthcare workers, and we had 79% strongly or somewhat agreeing with that, and only a negligible 11% expressing any disagreement. And again, the level of agreement is pretty consistent all across the provinces, with about 80% expressing support. And as usual, you find that the level of strong agreement is a little bit lower in Quebec than in some of the other provinces, but it's still pretty overwhelming, particularly in the Atlantic provinces. And
Or just to
when we
jump in, just
also,
an answer to
yep,
a question from Tony Clark, who's asking if the slides are published. Yes, they are, Tony Clark. They're on our webpage, and we would be happy if you wanted to dip into them. So you don't have to take screen caps, although you're welcome to if you want. And somebody else who has asked, made a comment about no real measurements or accountability at the provincial or federal level for the delivery of healthcare. In fact, that was very much in the news last week. The Canadian Medical Association has called for the setting up of a kind of an office of somebody who, a guardian or a watchdog of healthcare spending specifically, because when the feds transfer money, it's not always too clear where that money ends up. So that is a key issue, is where does the money go and what is happening in terms of accountability. So I just wanted to respond to that comment or
sure.
that question from the anonymous attendee in the Q&A. Sorry, carry on, Derek.
Yeah, I mean, so obviously these are things that are probably very easy for people to agree with because we're not really presenting the trade-offs or talking about where the money would necessarily come from or what some of the specific initiatives would be. But people clearly want action on healthcare worker retention and recruitment because it's been in the news quite a bit. And again, you can see that support for this is very strong in every single province. There's remarkably little variation there as well. So, I mean, those are the major, these are basically the highlights from the survey that we wanted to present to you guys this evening. But I guess now would be a good opportunity to Well, I don't know if Steve, if you want to delve into
Yeah,
the
yeah.
actual issue here.
Yeah, I can say a little bit about this. I was talking to my colleagues over at the Canadian Federation of Nurses Union. They're in the final stages of launching a new strategy on nursing. And as you know, they've put out, and many others have put out the three R's: recruit, retain, and return. The third one is return, to
Hmm.
bring people back into the system, either that have left for whatever reason. Of course, we know some of the major factors that's contributing to the shortage of healthcare workers is just, well, wages for one. And we've seen some pretty big strikes in Quebec and in Ontario, and labor action, nurses in particular, and others wanting better wages, but also working conditions. I mean, you imagine working in a job where you have mandatory overtime, where you have no choice. If you get called in, you got to go. And the burnout factor is huge. So anybody who you can't blame a person wanting an off ramp from that kind of life. And this is where we get into the privatization issue, where private companies are setting up shop and they're poaching people, exhausted healthcare workers, out of the public system, in some cases paying them more, giving them more control over their lives, and billing the public system a massive amount to kind of like rent these people back into the system, which drives up the cost, or just leaves people trying to find
It's
care
like the
in the
government
private
firing
system.
people and hiring them back as consultants.
You
Yeah,
got it.
Yeah.
that's a
Yeah,
good comparison. Yeah.
you
Yeah.
got it. So a federal strategy is needed, because this is what happens. Even the provinces that are trying to recruit more healthcare workers, where do they go? I mean, apart from other countries, let's set that aside because that's a huge issue, but they often poach from the province right next door, right? BC boasts about how many healthcare workers they pulled from Alberta. And, I think I've seen things like this. There's been problems between New Brunswick and Nova Scotia and PEI and the Atlantic region. And the provinces actually had to come to a tacit agreement, kind of a gentleman's agreement. They're mostly men, before the last conference of the Federation, that they would stop this practice. But this is clearly where the federal government has a role, because you're just spreading the problem around between the provinces. And if the federal government has got to bring something to bear on this, plus we're also getting virtual healthcare, which is poaching care across provincial lines, which is also promoting privatization. It cries out for a federal strategy on this, and not just a blank check. As you mentioned, we need accountability on where those dollars go. We need the metrics. That's why the federal government has been so focused on getting common metrics across all the provinces, because they call things different names and different definitions. So there absolutely is a federal role for creating a workforce strategy that deals with these three R's of retention, return, and recruitment.
So, Derek, I wondered, did you find, first question is, how does this poll, or how does this data compare to other polls that have been done? Somebody, anonymous attendee is asking again, what happens with this data? There are lots of surveys and issues identified, but it just seems like we've known about these issues for over a decade. What are the next steps? Which is always the question. I wonder, did you find any clues there? And can you tell us how this poll may or may not compare to the other attempts to gather data on this issue?
Well, I guess specifically if we're talking about pharmacare, I mean, I realize there have been other polls that have sometimes painted a different picture because there's different ways of asking the question. Obviously, if you were an opponent, if you were working for a pharmaceutical company and you were an opponent of pharmacare, you could ask questions in such a way that it would be you'll have to give up the drug plan you get through work in exchange for a bureaucratic government one size fits all scheme that isn't going to have as much, that won't cover as many things, or there's different ways of couching it. And there are also questions. I mean, we did find in the survey that as much as there's a lot of support for pharmacare, it's also not the number one priority like when you ask Canadians about, what is the top issue, uh, the biggest challenges facing the healthcare system, the waiting times for an emergency and for surgeries, the lack of primary care doctors. I mean, those are seen as much, much bigger concerns. The fact that some portion of people aren't necessarily able to afford prescription drugs is a concern, but it's not always seen as as the thing that's falling off the edge of the table to the same extent as some of the other issues around healthcare. So I think that that's one of the reasons why I think around pharmacare, as much as there's a lot of support for it, maybe where organizations like CHC have to come in, as well as some of our political leaders, is to sort of beat the drums around the urgency of it, because there's a lot of passive support for it, but it's not necessarily, when you ask people top of mind, what's the number one thing that our governments could do to solve the problem and the crisis in healthcare, pharmacare isn't always going to be the first thing people say. And that's not because it isn't important, but it's because other issues around healthcare are seen to be even more critical right now.
I wonder about the question of privatization, which is a big amorphous, I don't know how to describe it exactly, kind of like a zombie that doesn't die, because Steve was mentioning that when you privatize services, automatically the costs go up for the taxpayers. So there's a big problem with it, and then there's different forms of privatization. I wonder, Steve, what you'd like to, would you like to jump in on this at this point, where to comment on what Derek said about pharmacare, but in general, what the top of mind issues are for people?
Well, it's ever present, and I don't think a lot of people were out there calling for the dental care program either, but it has proved to be wildly popular. I mean, I've talked to dentists who's, and it's not even fully rolled out yet. They describe tears of joy of their patients coming in, seniors in particular, who lost their coverage when they retired and have wanting to have their teeth repaired. So sometimes they may not know they want it until they're presented with it. I think
Until they have it, and then they don't want it taken away, right? Yeah.
Exactly.
You got it. You got it. And I think pharmacare is going to be the same thing. Derek, you pointed those numbers out, the number of people that are going to benefit from this program, the number of people also who want it expanded, because once they see some people getting free contraception, free diabetes, free hormone therapy, here comes the heart drugs. Where's the, there's
Cancer drugs, where's
going,
antibiotics. Yeah.
Yeah. Yeah.
Right. And the list will go on, and then once one province gets it, it's going to start moving across other provinces too. So it's the thin edge of the wedge. So, and this is why, I mean, I've gone head to head against the big pharmaceutical companies and the insurance companies in Parliament, face to face in front of MPs, and they don't like it. They are concerned that this is the thin edge of the wedge, the toe in the door, or whatever, that this is going to spread across not only including other areas, but also all other provinces as it goes across. And that was our experience. If anyone was around to remember, when healthcare came in, public healthcare came in, it took 10 years really to build the kind of public system that we have now. And I think these programs are going to be the same thing.
One thing that's often occurred to me around pharmacare is that there is a conservative case to be made for pharmacare as well, because employers spend a hell of a lot of money providing drug plans to their employees, as well as other healthcare benefits. And if there is a universal pharmacare plan, you would think that a lot of small businesses and a lot of big businesses as well, but employers would see this as, oh, great, if the government's going to provide a drug plan to everybody, then we don't have to provide it, and that saves us money. So I sometimes think to myself that, if there is also a conservative or a more kind of quote unquote pro-business case to be made for pharmacare that could work with certain audiences.
Yeah, I would totally agree. And this is why the insurance companies are so afraid of it, because of course companies are their biggest customers by far. Not many people have private insurance plans. You might if you're retired or what have you, or maybe if you're self-employed, but by far it's companies providing it, and that they may start reducing their coverage as they allow the public to move on to to public plans. And I'll tell you, Derek, we have not me, but I have heard stories of previous generations of campaigners have gone to business groups and made this exact case that you're seeing. Precious few see it. I don't know. I can't understand.
It's weird because you'd think businesses are always
why.
looking for ways to cut costs, and this would like.
And we're willing to, I mean, you know, in the auto sector, even if you compare to U.S. workers, just our public healthcare system.
Well, I was about to say the
care,
fact that we have a public healthcare system is seen as a big competitive advantage for a lot of, you know, compared to the U.S. where companies that have to provide healthcare coverage as a benefit, it's an extremely expensive. You know, it adds to the overhead for every employee.
And I would just jump in and say that Canada is the only healthcare country that doesn't cover drugs. We are, you know, sort of like an outlier on the question of pharmacare. As soon as you step out of the hospital, it's a wild west out there. It's like a terrible melange of all kinds of stuff. And we're the only healthcare country that, for some reason, just didn't go down that road. And
yeah,
many of the healthcare countries that we compare to also cover dental care. Like, why were teeth excluded when in fact your mouth is a key element of healthcare? Oral care is key to overall healthcare. So it has to do with what Steve was mentioning, which is the way in which healthcare was introduced in the country. There was a lot of resistance. In fact, the doctors went out on strike in Saskatchewan in 1962 when the Tommy Douglas government introduced healthcare. When it finally reached Quebec in 1970, the specialists all went out on strike. So it's been a bumpy road, and it's bound to continue to be bumpy, but it's very important for us to be talking about these issues and raising awareness and doing polls like this, even though they may seem repetitive to certain observers. It's important to keep in mind that the public is much more pro-Medicare than many of its leaders. The vast majority of its leaders, in fact. Anyway, sorry, go ahead, Steve. I cut you off there.
Well, I would just say there's even greater economic advantage to this as well, because it's the cost when the cost when you don't have it. So, like for instance, I live in downtown Toronto. I'm in Regent Park. This is it's very mixed neighborhood. It's traditionally not economically well off, although it's very mixed. But I was at my Shoppers Drug Mart just the other day, and there was a person ahead of me in line getting a prescription filled. And okay, by those very superficial measurements, I might say that he's not part of the wealthier side of the community. And because when he asked the pharmacist what was the copay, that is like, what is that fee that they have to pay every time you get a prescription filled? And the pharmacist said $14. And the guy stood there with his prescription and thought about it and said, I think I can get cheaper somewhere else, and turned around and left. Now, is he going to find that? Or is he going to cut back on his medication? Because we know from healthcare providers that they see all kinds of people coming into the emergency department who've cut back on their meds, who didn't take their meds. It's called cost-related non-adherence. That's the official term for it, that when you don't take your medication or you cut your pills in half or whatever because you can't afford it. And then the situation gets worse. You end up in the emergency room. One study that was done in St. Michael's, where they took patients and divided them into two groups. One, they just let them go on their own to find medication, prescription medication, wherever way they might normally do it, whether private plan or not. And other people, they just mailed them the drugs for free. They just put them in the mail and mailed them for free. And over time, they found that the people who got the drugs for free performed much better as a group. And in fact, it saved the system $1,400 a year per person when they just mailed them free pills. And it was a huge success story, and shows the kind of savings that we're going to get from having this program.
So, Derek, were there any, just to go back to you as the number cruncher and the gatherer of the information, was there anything in the data that surprised you, that you were surprised to see?
I wouldn't say that I was surprised by anything. I mean, I suppose partly because I've seen enough numbers before that there are things that maybe would surprise the average person that don't necessarily surprise me. But I think again, maybe one of them is just how broad-based the support for pharmacare and for more measures to deal with the health with the staffing shortage are, and how it crosses political lines. That you find that, well, support is not as enthusiastic among conservative voters, but it's still very high. is that there's just a lot of consensus. And in a, when we're in a polity where there's so much polarization and where views are so entrenched on so many other issues, this is one area where there's just such a high level of consensus.
And that number that sort of jumps out is the 63% of conservative voters who are
Yeah.
in favor of pharmacare. I found that surprising. I mean, I thought probably the majority maybe, but 63% is a high
Yeah, no,
number.
granted, that's strongly and somewhat support, and a lot of them are in the somewhat category as opposed to strongly, but nonetheless, let's look at the
But that
glass
could
as
explain,
two-thirds full.
that might explain why Pierre Poilievre has been a bit cagey. You remember when we were in Ottawa when the bill was introduced on February 29th. I was in the House at the time. I was there when the bill was introduced in Parliament, and I remember reporters were scrumming Poilievre saying, "Do you support this?" And he kind of pulled that. Who was it? Was it Nixon who said, "Oh, I can't hear you," and wandered off down the hall? I can't remember. Some U.S. president did that, but he didn't give a direct answer. He kind of avoided it. So, and then when we looked at Derek's numbers, I think that begins to tell us why, because he knows that so many supporters of his party still want this program, including maybe Ontario.
So do you
Who
think
knows?
we should make sure that the conservative staff in his office sees the poll? Should we send it to them?
That's a great idea.
I suspect maybe they've seen it already, but what the heck?
Or
I
they've
mean,
seen similar numbers. I mean, the thing is, what I've often said to people is, you know, because the federal government doesn't tend to do a lot that affects our lives compared to provincial governments, when you have a more progressive federal government, they tend to do a lot of things. When you have a more conservative government, it's not what they do, it's all the things that they don't do.
or worse,
And
that they tear down.
or that they just let sort of rot on the vine. Like so they'll just stop funding something and let it wither. So it's always about they'll let things they'll probably avoid a showy spectacle of killing a program, but they'll just sort of starve it of resources bit by bit.
Via rail comes to mind.
Yeah, so that's the thing to be mindful of is I would imagine that Mr. Poilievre would probably avoid saying anything categorical about dental care or pharmacare, but that if he were to come to power and there would start being major cuts to federal transfers to provinces and things like that, again, it would be there would be an effort to sort of let it wither as opposed to doing something involving actually getting out an axe. That would be my expectation.
So just to go back to the Q&A, right off the top, somebody said, how do we mobilize Canadians to speak out, call their MPs, take to the street, etc.? I wonder, Steve, what do you say? What do you say to that?
Well, we have lots of things that we do, and we use a system called the ladder of engagement. Right, we find people that are have a bad experience, that connect with us some way over social media or something, a very low level of entry. We begin to identify folks like that, and then we begin to work with them. We give them more information. We respond to queries that we get from them. Then we give them opportunities to write letters. Hopefully, they get letters back from the members of parliament. That's a very empowering thing. And then, we offer people the opportunities all the way. Come to Ottawa once a year and be part of our lobby and go meet your MP face to face right in their office in Ottawa. And we had over 100 people do that last February. We held a big rally. We held dozens and dozens of meetings on the Hill for pharmacare and stop privatization. And so, people, wherever you are on that ladder, we're happy to have you, and you can move up the ladder as you want. So that's our strategy, to try to get people to move forward and to make the case really clear to their elected politicians who make the decisions about where these dollars go.
Okay, well, I think we're pretty hard up against the clock. I wonder if you want to make a closing comment, Derek, and a closing comment from you, Steve, and then we'll close down the proceedings for now. But I would just invite you to take a look in the chat. There's information about the poll. You're obviously welcome to sign up for our newsletter at the Canadian Health Coalition, and we do a newsletter in English on Wednesdays, and a French newsletter and news update on healthcare issues on Thursday in French. And we try and stay ahead of the curve on issues of interest to our members. And we have about 6,000 of them and a pretty big mailing list. So you're more than welcome to join us as we try and advance the debate and the quality of the debate on healthcare issues. And this data that Derek has shown us today shows that there still is a wide swath of the population that agrees on so many of these issues, which is actually very encouraging. And in fact, that's really the message that I think we can take from the poll. But I'm just going to throw it back to you, to Derek, and then.
Well, I guess all I would say is, like, we have some major provincial elections coming up this fall, and there will be a federal election in within the next year. So it'll be interesting to see how healthcare and this slant on healthcare emerges as a key issue. And the thing to bear in mind is that we're testing a lot of our arguments, but there are oppositional arguments to some of these things as well, and it's worth being mindful of the fact that that we're not to use a hockey reference, we're not trying to score on an empty net.
Yet another hockey reference.
Yeah.
Okay, so
the other side has not pulled the goalie.
So that was Derek Leebosh with the play-by-play, and now in closing, we'll hand things over to Steve Staples with the color commentary.
Okay, well, I'll try to be Bob Cole here then. I'll just add that it was interesting when Minister Holland was staying with the BC Health Minister, just putting forward the MOU the other day. Mark Holland mentioned somebody who actually wasn't in the press conference and kind of gave them a bit of a shout out about the announcement. And you know who it was? Don Davies.
Oh, the NDP health critic.
You got it. And so I'm sad that the CASA ended, that the 3-year agreement ended. I understand it. I get it. The way the politics works. I'm not oblivious to it, but we did achieve a lot during our health. We called it the Health and Hope campaign over the 3 years. Out of the 4 priorities that were listed in that agreement, we got some major investments. We got dental care, and we're on the cusp of pharmacare. And it really came from people coming together and the cooperation, Mark Holland in particular, and Don Davies, who guy deserves a medal, for working to bring about these programs. And I'm delighted, even though Don is not health critic anymore, Peter Julian's doing a great job in there too. But Mark Holland still has spring in his step, and he's out there making these deals. And the constellation of factors is there for us. It's just we gotta close the deal and seize this opportunity right now, and that's what we're going to do over the next few months. And hope everyone will join us.
Thank you to both of you, Derek Leebosh of Environics and Steve Staples. It was really very lovely to have you here. Thank you very much for those excellent slides, Derek.
Oh, you're welcome.
I'd like to thank also the board of the Canadian Health Coalition and our new chair, Jason McLean, and Tracy Glynn, who is the projects manager, projects director of the coalition, but really just the brains behind the entire operation. So I don't know, Tracy, if you can turn your camera on and say hi. Tracy Glynn, very, very wonderful ally and colleague. And a special thank you to all of you who joined us. It's always a joy to discuss and focus on healthcare, our most beloved social program, one that we care so deeply about and that we all need for ourselves and for our friends and our neighbors and all of us together in this project called Canada and I guess Quebec. So merci à tous et à toutes. A big thanks to all of you for joining us, and we will be bringing more webinars to you. This one is going to go up on YouTube shortly, so you can pass it on, and you can also check in and take a look at the survey and print it out and use it as it may suit you in the advancement of healthcare. So thank you to everybody and have a great evening. Look forward to talking to you again soon. Ciao for now. Bye.